Alrighty, so today we're going to be talking about very two specific and important details when it comes to heart function. We're going to be talking about the depolarization of the heart. We're going to be looking at the electrical signal pathway as it goes through the heart. A couple key landmarks such as the SA node, the AV node, and how the SA node firing kind of differs from the classic, cardiomyocytes. We're also going to looking at contraction, how depolarization is related to contraction, the contraction process, how it may differ a little bit, how it may be similar to normal muscle contraction, and how everything interrelates together, and everything keeps us alive. To start our discussion on the depolarization of the heart, we kind of have to start here. So we're going to have two different sort of depolarization patterns between our SA node and our cardiomyocyte. SA node is basically what's going to control our heart rate. This is the thing that is keeping our heart ticking. It's going to run on something called inherent automaticity. Big, fancy, scary word that actually isn't that scary, kind of once you break it down. So all that means, and you can kind of examine it down here, is that it's going to depolarize at about a rate of 100 beats per minute. Now this is going to be affected by some of our sympathetic nervous system and our parasympathetic nervous system responses and systems. But it's going to follow this nice kind of peak and valley, as you can see through here, some tracing. We don't really have a resting membrane potential, which is slightly different than kind of your classic, depolarization for muscles. It's just constantly either off and on, sort of. You're always building up to this, falling back down, building up to this, falling back down. There is no steady state where it's just happy and wants to be. It's kind of constantly in flux, constantly going. And to kind of circle back around, sympathetic nervous system and parasympathetic nervous system is going to have a pretty big influence on how fast our SA node is actually firing. Parasympathetic nervous system, PNS, is going to be responsible for slowing your heart rate down. That's why if you take random Joe off the street, as long as they don't have any heart issues, of course, and you take their heart rate, it's not going to be around 100, hopefully. You want it more around that 70 to 80 beats per minute. The SNS, or the sympathetic nervous system, is going to have the exact opposite effect. That's what's going to be speeding our heart rate up. We're really not going to be using this a whole lot unless we're kind of put in that fight or flight mode, This can be even exercise will kind of put you into that mode. And we have a cool system with it. So we start with the PNS stuff on, and then once we kind of get that response, is like, hey, we need to increase heart rate like now. We're not going to see this immediate switch between PNS to SNS. PNS is going to shut off, and then our bodies will see if the kind of normal 100 beats per minute is sufficient to kind of meet the workload that we're working at. And then if it's not, that's when we can see SNS turn on and then really start ramping up that heart rate. Greatest example, or how to kind of look this, is a brake in your car. When you come to a stoplight, foot's on the brake. You're waiting for the light to turn green. As soon as it does, you don't immediately press the gas. You let off the brake. There's a moment where nothing is happening. You're not speeding up or slowing down. You're just kind of in this limbo stage. And then you hit the gas. SNS, PNS works the exact same. And the thing that's predominantly going to be different with this versus something like normal myocytes, like in your quad or something, is that we're really not focused on sodium and potassium. We are, but the main kind of cause, and we'll talk about this specifically when we get into the cardiomyocyte and throughout the heart as a whole, is how important calcium is. So we're mostly focusing on the calcium leak here. That's kind of what's causing these peaks and valleys. Calcium might be one of the most important, if not the most important, kind of chemical that we need within our heart. Has huge cascading effects through depolarization, contraction, several diseases and things, which we'll discuss later. But comparing SA node to cardiomyocyte, right off the bat, you can see that their depolarization shape is completely different. Cardiomyocytes follow a similar, obviously not exact, but a similar to your classic depolarization. And what that means is, we're sitting here at that -90. Around -70, you're going to see those NA gates open. You're going to see them close up here. Na plus close. You're going to see the potassium open up. And then we start getting a little funky. So instead of going straight down like we're used to seeing in a normal kind of depolarization or your classic like myocyte depolarization, we actually get this little plateau. And then once again, I'm going to be saying this a lot, it's due to our old friend calcium. So we have that little kind of calcium leak slowly leaking out of the cell that's kind of causing this kind of delay before we hit this kind of big drop off here in charge. And then once again, once we get toward the bottom, we're going to have, as one of our good friends once said, our salty banana, our NAK pump, sodium potassium pump, that's going to return us back to that -90. So there's our general shapes for two. It's very important to know these to understand that how the SA node and the cardiomyocytes work are a little bit different. They're a little dissimilar to each other. Still the general idea, we just have a few different influences. So now that we know how we actually start this process, let's track the signal as it goes through the heart. So, as always, we're going to start by drawing our little potato here. Use this lovely red marker. You have our 4 chambers. You have our left atrium, left ventricle, right atrium, right ventricle. So, first one that we'll write is one that we have discussed already. It's going to be our lovely SA node. It's going to sit right at the top here of our right atrium. Then we're going to have a few other important important landmarks that we should know kind of before we stop or start tracking this pathway here. We're going to have our little bean here that we call the AV node. Let me space that out so you can see a little better. Then coming off the AV node, we have this little bundle here, just a bundle of nerves called the bundle of His. That's going to follow straight into your bundle branches, which are going to run straight down the walls of your septum here. And then those are going to lead into your Purkinje fibers, which are going to be surrounding kind of your ventricles here all the way around. So how does this all tie together? So our SA node fires, we get that depolarization around 100 beats per minute, and this is being affected by one of our nervous systems. So boom, we're going to see that signal propagate all the way through our atriums here. This is going to cause our atriums to contract and push blood down into our ventricles. It's going to be this propagating signal. That's one thing that myocytes have an advantage over normal muscle cells, as we have these little intercalated discs that allow signal to be going directly from cell to cell. We don't need a million different sites for nerves to attach to. They can kind of propagate the signal by themselves. It allows a nice kind of rhythmic contraction up top. So that signal is going to go down through the atriums. It's going to hit our AV node here, and then we're going to get some really cool stuff happening. So the AV node sits on this nice little layer of electrically inert cells, meaning that the signal cannot go to the ventricles. It stops right there, or it should, as long as everything is working together correctly. So that all this signal is going to get kind of caught up at the AV node. We're going to experience something called AV write it down here, AV nodal delay. And so what this allows is it'll make sure, allows for, excuse me, as it allows our ventricles to fully fill before we actually pump blood out. This is very important because if you think about it, if our atriums or if that signal is allowed to get all the way through, we're not allowing proper time for our ventricles to get fully set. And even past that, we would see kind of this kind of just squishy motion to where you're just basically squeezing a pump and the blood's not really, it's going to go somewhere, but not as effective as we want it. So this provides us for time for the ventricles to fill and to make sure that we're getting that nice rhythmic contraction. So after we experience that little AV nodal delay here, it's going to go down through the bundle of His where it splits into our left and right bundle branches. It's going to go down those bundle branches and then go back up through the Purkinje fibers. And this allows us to do, again, something really cool. It's pretty fascinating. This allows us to get sort of a top to bottom contraction of our atriums and then a bottom to top contraction out our ventricles. So this makes sure, again, like I said earlier, if we didn't have this very unique way of depolarizing and sending this electrical signal through, you're really just kind of squeezing through, which is not as effective as it kind of needs to be or it should be. This allows us to make sure we're squeezing all of that blood, kind of like wringing the towel out. We're squeezing all that blood into the ventricles to make sure that they fill, and then we're allowing those ventricles to contract up and push that blood where it needs to go. So all of that electrical signaling, it's cool and all, but it still doesn't really explain how things are pushing and how that works. So that's where muscle contraction comes in. So heart contraction, as you might guess, is going to happen in our little cardiomyocytes, specifically in our little sarcomere areas. So as you can see, this is our little diagram here. This is kind of like if you took a cross section of the muscle. So if you think of your classic like cartoon ham, you got your beef here, your little bone sticking out. Boom. We're looking in here. So direct kind of horizontal cut within the muscle. So a few things labeled on this diagram to kind of help us out, kind of familiarize ourselves with the area. We have our little T tubules here. That's what's going to bring that signal that we talked about through depolarization in deep inside of our muscles, so that we're not getting a weird it's to make sure that we don't have just kind of the surface layer contracting. Like if you have your base layer here, so just the top layer is contracting, we're getting full contraction. Same thing works with normal muscle cells as well. We have our sarcoplasmic reticulum. Here we have our individual sarcomere with our Z discs, these little black lines here. Titin, which I actually forgot to label here, which are basically just hold myosin in place. Red being our myosin. And these little blue lines may be a little hard to see because of the troponin on top of the green, but we have these little blue bars here that are our actin, and mentioned earlier, green is our troponin. But to get started, so we have that signal go through. All right, awesome, great, signal sent. They're going to be sent down to our T tubules, down into our muscle here. We have these two little sensors here. They're going to be electrically gated. And what they're really looking for, what their main kind of job is looking for calcium in here. Once these sense calcium going through our T tubules, once we kind of hit a threshold, they're going to send a signal to our SR saying, hey, listen, we got some calcium in the T tubules. It's time, I don't know what's happening, but it's time to contract. It's time to get ready. It's time to go. So our SR is going to be like, all right, cool, can do, dude. So it's going to prepare to release calcium and then eventually do release calcium into our little sarcomere here. Bring it down here to our lovely little sarcomere. So what's going to happen is the calcium is going to come in to our sarcomere and then bind to troponin C. Now, you may not have learned this in previous courses, specifically talking with kind of base level muscle contraction things, but we actually have three, not types, but three sort of sites of troponin. We have troponin I, troponin C, and troponin T. The great thing is that the letters pretty much correspond exactly to what they are. Troponin C, that is where our calcium is actually going to bind. That's the binding site for calcium. Once that is bonded to calcium, we're going to move to troponin I, which is inhibitory troponin. So what's that is doing is blocking those sites on tropomyosin that's not allowing myosin to actually grab actin and create those cross bridges. That's what troponin I is. And troponin T is real simple. It's just kind of what's holding troponin onto that tropomyosin and actin. So just kind of refresh. Calcium is going to move into the sarcomere. It's going to grab on to troponin C, or bind to troponin C. Troponin C will then move troponin I out of the way and allow myosin to create those classic cross bridges with actin. And it's just as a little review as to what happens. Myosin will then bind. We can do it right here in our little diagram here. Do our little heads. Boop, boop. There's our actin, nice and lovely. So myosin is going to come up, bind to this actin. We're going to have our two heads here of myosin grab onto this actin. And then we're going to see, boom, there we go. So unloaded onto this myosin, we have one ADP and one inorganic phosphate, if I can speak. One head is going to pull. It's kind of like pulling a rope. So you have your two hands on it. You're going to pull one head is going to pull, and that's going to release an ADP. Then the next one is going to grab on, or well, it's already grabbed on, but so you had your first pull, your second one's going to pull. That's going to release that inorganic phosphate. So then what we're left with is our heads now kind of cocked in that position, roughly, have now fully pulled our rope. So now, there's only one thing to do, it's to let go. So how we're going to let go is you're going to have ATP, our lovely, lovely, magical energy chemical here. It's going to come in, bind to that myosin, so that myosin lets go, gets recocked, ready to go. ATP is going to go on there, allow it to let go, and it's going to break down into that ADP and that inorganic phosphate again. So, boom, we got that magic. Calcium's in the cell. We're living it up. It's great. Contraction's happening. Actin and myosin are going crazy. They're having fun making their cross bridges. But that can only occur if we have calcium in the cell. So what happens when we don't want contraction? The great thing is we have two little chemical sensors here that are responsible for the uptake in calcium and calcium regulation within the sarcomere and those cardiomyocytes. Our calcium uptake is being responsible here at, let me do it in green so it matches, circa here. There you go. And its primary duty is going to be reuptake of calcium. So once we hit a level where our body's like, okay, we don't need any more calcium, it's time to reset our SR, make sure that we have plenty for later. Circa is going to activate. It's going to activate very much like a vacuum. And it's going to come through and suck up all of the calcium that was dumped in here. So once that goes in there, calcium is going to come back up. Circa is going to take that up to make sure that our SR isn't, either totally depleted, to make sure that we're not misusing calcium where we don't need it. And again, as everything, we have a check. Everything runs off of checks and balances. We have this little chemical here, this PL. It's called phospholambdin. And it can be seen kind of as the off switch to circa. So its whole job is once our bodies kind of sense, hey, like we've taken up calcium, we're good, circa, you can calm down. They call in phospholambdin to basically turn off the vacuum. So it's its off switch, power switch, however you want to look at it. And this is how we actually generate force within the heart. Without these two processes, specifically depolarization and contraction, we just wouldn't be able to survive. Our heart wouldn't be able to produce enough force to pump blood out as it needed. These are two very important systems within the heart, and this is what keeps us alive.